marketing director here at Smith PT, and we have Dana.
I am a physical therapist and specialist in concussion and Parkinson's and dizziness management.
So we are super excited to share that Dana got this awesome new certification recently, and we are going to be offering that as a service to our patients. So Dana, can you tell us a little bit about it?
Sure, I just completed the LSVT BIG certification, which is this amazing program for Parkinson's patients.
So what all does the program entail?
Sure, so the program is an intensive 4-week treatment program where the individual comes to therapy 4 days a week. They get extensive homework assignments, and the cool thing about it is that it's tailored to the patient's needs and their goals.
In order to get started with the program, is there some kind of screening or diagnosis needed?
So the first appointment that we do is an evaluation, like we would with any other physical therapy patient. And during that evaluation, we use some of the cues and techniques that we incorporate into the LSVT BIG program to see if those techniques are effective for the individual, and if they are and we see changes, we can see changes right away with the right candidates, which is really cool. So if they respond to those cues, then they're a good candidate to participate in the program.
Is this a program that can be used for people that are newly diagnosed with Parkinson's and maybe have been living with it for a while?
Absolutely, yeah. The sooner we get people in always is the better, but people from 20 years post-diagnosis have still started with the LSVT program and have seen tremendous results. So anywhere along that journey is great, and the program can be adapted to the person's ability level.
So you go through your 4 weeks of treatment, 4 days a week, so it is pretty intensive, it sounds like. What happens after that 4 weeks?
Yeah, so we don't just abandon a person, which is good. That person is definitely encouraged to continue with their home program and their exercises daily, and it's something that should be incorporated along with other activities that they like too, because we know Parkinson's patients benefit so much from exercise in general, but definitely to incorporate these. And then what we recommend is that 6 months after they are finished with the initial program, that they come back in for what we like to call a tune-up, and we kind of recheck where things are at, modify the program, modify their home exercises, and hopefully that's good enough to get them through. Otherwise, we can always jump back into the 4-week intensive if we need to. Individuals living with Parkinson's share a lot of the same characteristics. So their movements tend to be smaller, their movements tend to be slower, and they can even experience freezing of movements where they just get stuck and it takes a while to get out of whatever they're in. And the LSVT program, the LSVT BIG program, I should say, because there's a loud program for speech too, but the BIG program actually addresses all of those movement problems, and you see a huge increase in the quality of their movement. It's no longer small and shrunken down, it's more normalized, and there are strategies that we teach them so that they don't freeze, that they can get out of it more efficiently. It helps with their confidence, it helps with their balance. You know, a lot of these individuals are nervous to leave their home or avoid social situations because of their symptoms, and this really helps them get back to all the things that they enjoy doing.
Anything else you want to tell us about the program?
Well, it's available now. I'm so excited to get it started, and as a therapist, you know, we love to see our patients improve. That's what we live for, and we love to help people meet their goals. And this program is so wonderful at achieving those objectives that it's probably one of the most rewarding things that we offer here.